and throughout it. Right. He's going to give the history, he's going to give the case example, and then we're all excited about it, so we want to know how soon we can have access to it. Right?
Yeah. Do you think we should ask a question in here?
Great, guys. It's good.
We're having
It's, and that way the patients know it's real stuff. You know, that it is your heart having to work harder because your arteries are thick? And these answers are now available, which is amazing. And you know, when you were doing it to me, I'm like, wait a minute.
Recording.
We're trying to look at my
Jim's
heart,
right.
so why is he
You're
not
crushing
doing
it.
this on my neck?
We're
Well,
crushing it, Joe.
and then driving this
I'm under-
morning.
I'm under your
I'm
umbrella
right
here.
too, right? So if we think about it, and correct me if I'm wrong, but it's like when you're merging these two lanes in a highway and you're getting towards that tunnel.
No, we got this.
We need more questions.
Oh, no,
No,
no.
we don't.
I'll talk most of this. Yeah, he's going to talk through most of it.
Okay, but
Right,
don't
we got the
need
models.
something like, what does it mean? What can they do?
Yeah. Well, when he's talking about the case, like, what are we looking at here? Yeah, like, what does it mean? And what is this patient? What can we do with it? Yeah, it's already recording, so there's no stress. So you introduce me and then say, what the heck am I doing here? Or how long is this? How is this tool clinically useful?
Okay. Joe and
Ence,
Ence.
loose ends, independent ends.
Ence. Okay. You're here to talk to us.
He'll answer that. Just project your voice right into that and start it whenever you feel comfortable.
Okay, we might have to do a couple takes.
Yes.
Okay.
I'm your wingman. You got it. You got it. And I'm here shining rainbows to you, right? Total energy going your way.
Okay.
I'm Dr. Janel.
Okay. We got this. Yep, we got this. Hi, I'm Dr. Ludenia here at Nature Cures Clinic, and today I have with me Joe Ence.
With Vasal Labs, I have an ultrasound machine, and with that, we can see cardiovascular disease. We can look at the layers of the artery. We can tell you if there's any plaques, which are very common, and we can tell you about inflammation in the artery lining. And this is a measurement that we can improve, we can track, and we can see the end result in the artery. We can see heart disease. So patients who have borderline cholesterol, who have always wondered, like, is that adding up on me? Because once in a while, it really is. How can we see it? How can we make it better? So that's what Vasal Labs is doing in your clinic.
Okay, great, thank you. And so Joe, you were kind of,
Just splice.
okay. So do I say this question?
I'll just go to the next, she'll cut it. Tell me about, the patient. Or how long has this?
Yeah, do I ask how long it's been available to physicians?
Yes.
Okay. So Joe, can you tell me how long this has been available to physicians?
Yeah, only until recently has it been available on a larger scale. This test has been used in research. It's the test they use to validate the statin class of drugs like Lipitor or Crestor. To prove that they work, they make sure that it stops inflaming and that there are fewer heart attacks and strokes. So it's a research-based test, but it's so visual. We can see the clogging of the arteries, and it's so informational for these patients to see the disease coming before it actually gets us. So as ultrasound machines have gotten smaller and the internet's gotten better transmission, we are able to bring this to more people with higher quality. So only in the last few years has it been publicly available, but you still need to know a doctor who has access.
Okay. All right. So you were going to tell us about
I had a fascinating experience.
let's hear it.
All right. I was down in Florida and I had a booth at a health fair. And this man came up, mid-60s, reasonably healthy. And he said, I had a coronary calcium score. I had my heart looked at and I have no calcium in my heart. I am bulletproof. I said, oh, okay, that's great. I'm happy for you. You want to check? It's like, I don't need a check. So then something of a wager started happening between us. And I said, I can put this probe on your neck very easily, very quickly. and I can show you if you have it. And he said, I'll take that dare. I'll take that bet. And the sad thing is he found out immediately his artery was 50% clogged and he had no idea. And it's a sad reality that every once in a while, well, most of us at some point in our life are going to find out we have a health condition. And the earlier we can address it, the earlier we can fix it, the less harmful it will be to us in the long run. I feel for this guy because his whole life is going to change. He's got to make changes. There's no runway left for him to indulge in bad habits. So it was a very educational experience for all of us for him to see that his arteries were damaged. And
Yeah, what was his reaction when he saw that?
sober. He was very sober. He hatched a plan with his doctor. Later that week, he got a good heart attack and stroke preventionist, somebody who specializes or takes extra training in making sure there are no heart attacks and strokes. And he's on the path. I mean, there's great therapies. This is definitely addressable and fightable, this heart disease. But you've got to know what's coming, and better tools are out to see and address to make sure that you avoid these issues. I have been so happy coming here, Doc. Thank you for inviting me.
Well, thank you for coming and sharing this amazing tool we can start using.